Why do we say that moderate alcohol consumption is good for health? Well, this belief has been widespread for a long time, but recent research is seriously questioning it. But first, where does this idea come from? False. For decades, several studies have suggested that moderate alcohol consumption, particularly red wine, could reduce the risk of cardiovascular diseases. And one of the arguments most often put forward is the French paradox. It's an observation that the French, despite having a diet high in saturated fats, have a relatively low rate of heart disease, which has been attributed to their regular consumption of red wine. And this hypothesis led to the conclusion we know: a glass of red wine a day would be good for the heart. And this could be explained by its compounds, such as the polyphenols present in grapes. However, as we now know, this association is simplistic and doesn't take into account other factors, like the Mediterranean diet, lifestyle, or simply methodological biases in the studies. Many of them focused on the benefits of alcohol, but used inadequate comparison groups. For example, the abstainers included in the research were often former drinkers who had stopped consuming alcohol for health reasons. And that skewed the results, of course. And then, many studies have failed to establish causation, only correlations. Correlations between moderate consumption and better cardiovascular health. But this could be due to other factors, like a higher socioeconomic status or healthier lifestyle habits. And then, anyway, recent research, in particular, this 2022 study, published in The Lancet, shows that no amount of alcohol can be considered completely safe. Even moderate consumption slightly increases the risks of certain cancers, particularly those of the breast, liver, and mouth. So, if we try to summarize everything I've just told you, current scientific evidence indicates that there is no level of alcohol consumption that is risk-free. The perceived benefits of moderate alcohol, especially for the heart, are actually the result of incorrect or biased interpretations.